today we've organised a summit to tackle falls in care homes. Falls are a particularly serious problem or issue amongst the elderly. As you get older, it's more likely that you'll fall over. So today we've gathered a lot of staff, a lot of workers from care homes, also NHS staff, people from the CQC, myself from Public Health England, and we're all here to tackle the issue.
Today's event is really good in sharing practice, listening to what other people are doing in other areas and taking that and moving it forward.
The focus on falls is a really exciting opportunity to really improve services for patients. If a patient falls, particularly in a care home, it can often be catastrophic for their physical health, but also their mental health and their confidence.
In terms of the improvement work, we've developed a falls spreadsheet. It's an Excel spreadsheet that the care homes can log any falls that happen for the residents in their care home. The idea of the spreadsheet is that it gives them a dashboard and they can look at the times of days of the falls, the days of the week that they're happening and week numbers and so on and so forth. And that allows them to be able to start to understand what's happening in terms of the falls within their own care home setting. They can look at that over a month, they can look at it over a week, they could look at it over a year.
Today we've heard some really good practice around safety huddles, the work in Scotland, and to think about how we can prevent falls happening and how we can work with care staff to understand what things might seem little, but actually if we do a proper risk assessments and think about the person as a whole, how we can prevent falls from happening in the first place, and when they do happen, what we can do to prevent future falls.
The safety huddle is a very brief meeting every day. It takes about 5 minutes. It involves every member of staff that's working within the home at that particular time each day. We talk about the risks to people who are at risk of falls, and we're very specific, so it's not a handover, it's just a very brief meeting about the people that are at risk of falls on that day, what might have changed and what we can do differently. So we're not going to stop falls, but we want to reduce them and make sure that we're looking out for the people who are at risk of falls.
Some of the most vulnerable people in our population live in care homes. They are their home, they live there for a number of years, and they are very vulnerable, and as a result they are more susceptible than most of the population to falling. And that'll be possibly because they have problems with their eyesight, they might have problems with their balance and their mobility, and those factors combine to make them a very at-risk group of people. I really want care home staff to continue to think about their residents, focus them on them as individuals, and see what we can do to both improve the environment and enhance their lives so that they're less at risk of falls.
My message to care home providers and staff would be work together, learn from others, and listen to what good services that have been rated outstanding, listen to what they do, and as I say, learn from others and implement it in your own service. So don't be frightened to do that.